were positive. Since the start of the public health emergency, local public health test sites across Georgia have collected more than 32,000 specimens for testing. Last week alone, by aggressively pushing for more testing, local departments collected 12,086 specimens for testing, a 64% increase from the previous week. Georgia's public health departments now have 49 test sites open across our state. Yesterday, we also announced a partnership with Walmart, eTrue North, and state and local officials to set up drive-through sites in communities with limited testing access. Beginning today, a mobile testing unit will now serve Augusta, Milledgeville, Tifton, and surrounding regions on a rotating basis. This unit will test Georgians with symptoms of COVID-19, and healthcare providers and first responders can be tested whether they have symptoms or if they do not. Georgians can make an appointment at www.doineedacovid19test.com. Again, www.doineedacovid19test.com. And on-site scheduling will also be available. We are grateful to Walmart, eTrue North, and community leaders for their help to get this operation up and running. To prepare for patient surge, our hospitals have worked around the clock to identify hundreds more general use and critical care beds for COVID-19 treatment. Hospitals were able to identify hundreds more, and as of this morning, we have 1,023 critical care beds available for patients across our state. It is the highest number of critical care beds that we've had available since hospitals began tracking this data. Ventilator use has also declined over the past few weeks. There are roughly 1,000 ventilators in use across Georgia, with more than 1,800 ventilators available, for a total capacity of 2,800. Currently, there are 9 recovering COVID-19 patients at the alternative care facility at the Georgia World Congress Center. They were transferred from Grady, Emory, and Wellstar to open acute care hospital beds for incoming patients. We continue to coordinate with our hospitals to monitor capacity and, if needed, to accept non-critical or non-intensive care patients. In Southwest Georgia, as you know, we partnered with local leaders to build out Phoebe North in Albany for use by nearby Phoebe Putney Memorial Hospital. Of the 12 ICU rooms completed on April the 20th, 10 are currently occupied. And out of 30 general patient rooms that we have built, 19 are currently occupied. By April 29th, we expect to have an additional 29 rooms with a minimum of 15 new ICU rooms. Although we are seeing declining transmission in the community, we will continue to identify opportunities for expanded access to ensure that locals have what they need to fight this virus. As I have mentioned previously, the state purchased 4 temporary hospital units to deploy to Albany, Rome, Macon, and Gainesville. By May 6, we will complete installation of units at Phoebe Putney Memorial Hospital in Albany, Floyd Medical Center in Rome, and Navicent Health in Macon. Phoebe Putney Hospital will gain 24 general hospital beds. Floyd Medical Center in Rome will gain 6 critical care beds and 14 general hospital beds, and Navicent Health in Macon will gain 7 critical care beds and 17 general hospital beds. By May 14th, when installation of the 4th unit is complete, Northeast Georgia Medical Center in Gainesville will gain 10 critical care beds and 10 general hospital beds. As you know, across the nation, the coronavirus has had a devastating impact on long-term care facilities, putting vulnerable populations at risk and causing alarm among public health officials, healthcare professionals, and our families. Georgia's battle with COVID-19 in these facilities continues to wage on, and we are fighting it literally with everything in our power to keep the medically fragile and elderly out of harm's way. As you know, on April the 8th, I signed an order mandating strict sanitation protocols and changes in existing living arrangements, including a ban on visitors except for end-of-life circumstances to stop the spread and improve conditions. The Department of Community of Health has been working day and night to check for compliance and hold facilities accountable. Surveyors are contacting facilities daily to ensure they're utilizing appropriate resources to safeguard residents as well as staff. The department is also publishing reports every Monday through Friday to show COVID-19 cases and fatalities in licensed facilities, giving families the transparency that they deserve to protect their loved ones. The department has also launched a temporary nurse aid training program to address staffing challenges in long-term care. This program was established with the assistance from the Georgia Healthcare Association and Allied Health Solutions to provide quick onboarding for nurses' aides needed to care for residents during this emergency period. I commend Commissioner Frank Berry and his team for developing the resources for our Georgia families. For weeks now, my team has worked closely with the Trump administration and our federal counterparts to mitigate the impact of this virus in Georgia. Our decisions and directives are informed by data and public health recommendations, and we remain focused on protecting the lives and the livelihoods of all Georgians. To slow the spread of COVID-19 and prepare for hospital surge capacity, we ask Georgians to shelter in place and close specific businesses throughout our state. Most businesses remained open with restrictions to ensure community health and well-being. We were successful in our efforts to protect Georgians as well as our state's healthcare infrastructure. With favorable data and approval from health officials, we took a measured step forward by opening many shuttered businesses throughout Georgia for limited operations. And starting today, theaters may reopen and restaurants and dining rooms, including those at private social clubs, which are allowed to resume dine-in services if they meet certain mandated criteria that will help continue to prevent the spread of COVID-19. Bars, nightclubs, operators of amusement park rides, and live performance venues will remain closed, and the shelter-in-place order remains in effect through April the 30th, 2020. Medically fragile and elderly Georgians must continue to shelter in place till at least May the 13th. And as we assess the situation, we will continue to provide updates. I'd like to ask all Georgians to help us double down on protecting our fellow vulnerable citizens. As you know, this disease has a wicked effect on these individuals, and we got to continue to raise awareness and take care of those folks and continue to combat the issues that we're seeing in our long-term care facilities. Over the weekend, the Department of Public Safety was on call to respond to complaints regarding compliance with the executive orders for specific businesses that were reopening. On Saturday, none of our 9 Georgia State Patrol command centers reported any sustained complaints of non-compliance. On Sunday, the Georgia State Patrol received 12 calls with only 2 sustained complaints, both which involved large gatherings. Officers used these opportunities to raise awareness about social distancing rules, as they have been doing for weeks now across our state, and I'm proud to say that both groups voluntarily dispersed. Georgians have been heeding the advice of our public health officials and our law enforcement to ensure the health and well-being of customers and workers. But we will continue to monitor compliance in every region of the state. And before I move on, I want to take a few minutes to thank all those in our law enforcement community for their work through this pandemic. Like our healthcare workers, they have worked long hours to keep our citizens safe in every zip code, and we appreciate their sacrifices. I hope you all will continue to keep them in your thoughts and prayers, as well as those that are supporting them while they're away from home. And please pray for the loved ones of fallen Smyrna police officer Christopher Ewing, who lost his life in the line of duty just a few days ago. He was certainly beloved by his community, and he will be missed by them and us. Working with the Georgia Hispanic Chamber of Commerce President and CEO Santiago Marquez, who serves on our Community Outreach Committee, and Insurance Commissioner John King, we are strengthening efforts to inform Georgia's Latino community about the risks of COVID-19. Partnering with the Mexican Consulate, General King, and Mr. Marquez, we will continue to actively engage communities across our state, starting in Hall County. Over the past few weeks, as other areas of our state have seen reduced transmissions of the virus, the Gainesville area has experienced an increase in cases, and our hospital partners in the area are seeing more hospitalizations. General King is on the ground there today speaking with leaders in the poultry industry to ensure that their workers understand the public health guidance and that we continue to work together to stop the spread. Under the leadership of General Cardin, the Georgia National Guard, as you know, has worked tirelessly to assist emergency response efforts across our state. Currently, there are 3,145 soldiers, airmen, and State Defense Force personnel engaged in the COVID-19 response with infection control teams, medical support teams, food bank support, school lunch delivery, and general support teams as needs arise. Right now, there are 978 personnel working in 69 infection control teams assigned to decontaminate Georgia's 790 long-term care facilities, including nursing homes, assisted living facilities, personal care homes, community living arrangements, hospice, and similar facilities. To date, these dedicated teams have provided critical support by sanitizing the facility and training staff on enhanced infectious control protocols to 710 facilities, which is 90% of Georgia's long-term care facilities, with some that have received multiple visits. Given the heightened risk of adverse consequences for the medically fragile and elderly, this work by the Guard is truly life-saving. Their efforts have been highlighted by the Trump administration as well as national, state, and local media, and they have started to train other states on their practices. Their hard work, as you know, does not stop here. Right now, the Guard has 206 personnel and 20 medical support teams deployed to 20 hospitals in Georgia, lending a helping hand to our healthcare workforce and necessary medical care to our patients. They have 190 personnel and 7 hospital entry support teams, which are deployed to conduct patient arrival screening at healthcare facilities. 170 soldiers are supporting 8 food banks, loading and unloading shipments and packaging containers for distribution. And at the Atlanta Community Food Bank, supporting the movement of 6 million pounds of food, the equivalent of 5 million meals. There are over 55 service members helping with school lunch deliveries, supporting the delivery of over 137,000 meals to students just in Fulton County alone. Soldiers are also providing support to the Department of Public Health with drivers and couriers at 13 of their 18 regional health offices, logistics support at their warehouse, and reinforcements at the test sites. The Guard is supporting Walmart's mobile testing initiative in Richmond County today and will support them in Milledgeville and Tifton in the coming days. Personnel are providing reinforcement at 9 specimen collection sites in conjunction with Augusta University, covering Albany, Moultrie, Decatur, Forsyth, 2 sites in Atlanta, Kennesaw, Morrow, and Sparta. As I mentioned last week, the Guard has galvanized 10 mobile strike teams for test specimen collection, focusing on nursing homes, first responders, law enforcement, and mental health facilities across our state. They are also supporting our partnership with Augusta University at their command center with 49 personnel. I want to applaud the brave men and women who have answered this call to service, who are fighting the virus with every fiber of their being. Speaking of local heroes, we have a great resource for our frontline healthcare workers. I don't think there's any doubt that they are our heroes of today. The Battelle decontainment system is set up right here in Atlanta. The Battelle decontainment system is a self-contained device that uses vapor hydrogen peroxide to decontaminate N95 masks. This is a big piece of equipment. It consists of 8 20-foot shipping containers, and starting today, it can decontaminate 80,000 N95 masks per day. 80,000 masks per day. Each mask can also be decontaminated up to 20 times. This system will give us the ability to recycle critical supplies, and it is currently available to all medical facilities, long-term care facilities, as well as first responders. I want to encourage these facilities and others to reach out to GEMA and take advantage of this resource as they continue to work on the front lines of our fight with COVID-19. Over the last several days, many have written about Georgia's plan to slowly reopen the businesses shuttered by our shelter-in-place order. And many more have written about the President's insight and advice on our game plan. Rest assured, the President and I share a common goal, and that is to protect both the lives and the livelihoods of Georgians as well as the American people. We had another great call today with the President, the Vice President, members of the administration, the National Task Force, and the nation's governors. I want to continue to applaud the President's leadership during these difficult times, and we are grateful for the resources that they are providing as we work to keep Georgians safe and ensure a bright and promising future in every corner of our state. And while it is easy to get discouraged or lost in a lot of noise, I have found inspiration and encouragement from small business owners who are able to safely open their doors and serve their customers in their city or their town. I know this situation can test your patience as well as your faith, but please know that we stand behind you. Over the weekend, I also heard from doctors in our state concerned about patient health and well-being. Given the shelter-in-place order and the need to social distance, many with chronic disease or medical needs have avoided the doctor's office or the pharmacy. If you have a medical need, please take advantage of telehealth opportunities that many doctors have embraced during this pandemic. At the very least, please call your physician and check in and see if it is a good time to schedule your appointment. Make the necessary arrangements today to ensure a healthy tomorrow. I want to close today with a call for renewed unity. These are unprecedented times in our state and our nation, but we are making great progress. We have accomplished much, but there is still a long way to go. There are differing opinions on how best to tackle the COVID-19 virus and how we reopen parts of our economy. The path forward to ensure a safer, stronger, and more prosperous future for our state. But I can promise you this, there is more that unites us than divides us. We all want to protect our families and our neighbors. We all want to emerge from this pandemic safe and victorious. So please stand with us in the days, weeks, and months ahead. Encourage your loved ones and your friends to continue to follow the executive orders and the social distancing guidance. Find a way to support your local business and take care of those neighbors that are in need. Use social media to share important updates and highlight the many good things that we have going on around us. And I would ask all Georgians to do as I do every day and to do as we did earlier today in this same Georgia State Capitol, and that is to pray. To pray for the state's health leaders who are helping us chart the course forward. Pray for those who are on the front lines of our healthcare facilities, our first responders, and many others, as well as those that are supporting them while they are working long hours away from home. Pray for all our elected officials, from the president, state officials, to local officials, who are doing what is right to help the people of this country and this state. I urge you to continue to follow the guidelines, and especially, let's continue to take care of the most vulnerable to this evil disease. And if we do, I am confident that together we will defeat the coronavirus and our best days will remain ahead. Well, that will take some questions.
Thank you so much.
You've been listening to Georgia Governor Brian Kemp give an update on the COVID-19 pandemic here in the Peach State. We want to also tell you that just within the past couple of minutes in South Carolina, Governor Henry McMaster has extended the state of emergency in the state of South Carolina for 15 more days. Again, as we've been hearing from Brian Kemp with an update here in Georgia, Governor Henry McMaster in South Carolina has extended the state of emergency in the Palmetto State. We'll have much more on both of the governor's reactions today. We're also going to hear from the president. Donald Trump has a press conference scheduled for 5 o'clock this afternoon as well. We'll talk about all that here in just a couple minutes. WJCL 22 News at 5 coming your way in about 8 minutes from now.